Welcome to the Alabama School Personnel Training on Suicide. This is a 4-part training consisting of an overview on suicide and 3 following sections on suicide prevention, intervention, and postvention. The objectives of this training are to inform you of the prevalence of suicide, provide you with basic information on suicide, and give you the tools to implement proper protocols around suicide in your school. During this overview section, these 5 listed areas will be covered. The relevance of suicide training for educators. Common terms and definitions relating to suicide. Alabama adolescent statistics. Requirements of schools under the law. A few questions to test your understanding. Based on the amount of time youth spend in the learning environment and time interacting with school personnel, there is no question that understanding suicide, learning how to identify suicide ideation in students, and assisting a student in connecting with professional mental health professionals is essential to the well-being of our youth, and therefore our role in the K-12 education world. This map shows the percentage of students in 2019 who felt sad or hopeless almost every consecutive day for a minimum of 2 weeks, to the point that they stopped doing some usual activities. The values range from 28.5% to 45.3%. As you can see, Alabama, along with Alaska, Arizona, California, Idaho, Nevada, New Mexico, Oklahoma, South Carolina, Tennessee, and Texas range from 37.4% to 45.3%. This video was done by the Focus program at Hewitt-Trussville High School. Please watch. There are 3 levels of suicide engagement: prevention, intervention, and postvention. Prevention. Activities implemented prior to the onset of an adverse health outcome, for example, dying by suicide, and designed to reduce the potential that the adverse health outcome will take place. Intervention. Activities implemented to intervene and improve a situation which may have a potential of an adverse health outcome, and designed to support individuals involved in the situation. Postvention. Activities following a suicide to help alleviate the suffering and emotional distress of the survivors and prevent additional trauma and contagion. We will be focusing on each one of these levels of engagement over the next 3 sections of this training. As you read each definition, you may have noticed that each begins with the word activities. This lets you know that action is required by each of us. In other words, prevention should occur year-round as you focus on reducing risk factors and promoting healthy and positive behaviors. Suicide intervention is a direct effort to stop a person from attempting suicide. Intervention occurs immediately when you hear or notice the display of warning signs in another. Suicide postvention consists of activities that facilitate recovery after a suicide attempt or the tragic loss of someone. At this time, be aware of the elevated risk for suicidal behavior among other students in response to the tragedy. These key terms are important to fully understand as they will be used throughout this training as well as in your school protocols. Read the definitions that coincide with these terms. Assessment. Cluster. Crisis response team. Evidence-based practices. High-risk student. Licensed mental health professional. Mental health. Protective factors. Screening. Self-harm. Suicidal behavior. Suicidal ideation. Suicide. Suicide attempt. Suicide contagion. Risk factors. Warning signs. Understanding the basic differences between risk factors and warning signs is very important. Simply stated, risk factors are characteristics or conditions associated with an increased risk of suicide. Warning signs are signs displayed that signal a person is in imminent danger of attempting suicide. These terms will be expanded upon in other portions of this training. Most people are not aware of the frequency of suicides since the media does not cover them out of respect for the family unless it is a celebrity. Take a moment to look at this statistical information related to suicide deaths in 2018. Did you know in 2018, Alabama had more than 3 times as many people die by suicide than in alcohol-related motor vehicle accidents? Did you know in 2018, Alabama's suicide rate was 16.8, which is higher than the United States rate of 14.2 per 100,000 individuals the same year? Did you know in 2018, the second leading cause of death for youth ages 10 to 24 in Alabama was suicide? Suicide is a serious but preventable public health problem that will have lasting harmful effects on individuals, families, and communities. Take notice of the difference in the Alabama high school comparison data from 2015 versus 2019. As you see, the percentage of students who were able to respond yes to these 4 questions increased across the board in 2019. Why are the number of Alabama students experiencing feelings of hopelessness and suicide ideation growing? Now let's take a look at Alabama numbers compared to the average across the United States. Alabama rates are consistently higher than the national average. All of this data supports why you are taking time out of your busy schedule to focus on better equipping yourself to address suicide amongst your students. Before we move on, think about what this data may look like from 2020, a year consumed by a global pandemic, a year of illness, quarantine, and social distancing. What percentage of high school students in 2020 do you possibly think responded yes when asked, "Have you felt sad or hopeless every day for a minimum of 2 weeks over the past 12 months?" This training, along with the model policy provided to the LEAs, is in compliance with the law. Jason Flatt Act, SB 11, Youth Suicide Awareness and Prevention, enacted May 8, 2016, amends the 16-28B-8 of the Code of Alabama, 1975. As you see, listed are 6 bullet points to summarize the requirements of the Jason Flatt Act. Once you complete this training, you will be able to know you are meeting the second item listed. Take a few moments to read through this short list. Now, take a few minutes to answer the first series of questions to test your knowledge on Part 1 of this training.